Hi, everyone. Welcome to Talking Live with Macy. It's good to see all of you back after 1 month of not seeing you. So many things have happened over 1 month with the Hari Raya holidays. There were so many holidays going on. So, what we must do right now, of course, after you haven't seen me for 1 month, is we're going to follow the same format, which is to get more people to join the show because we have an exclusive giveaway from Prince Scott Medical Center. And I feel that it is very important for all of you to tune in to find out more about a topic very close to my heart: reproductive cancers in women. And it's very close to my heart because a lot of things, like I said, have been going on. And I want females to be more aware of symptoms of what reproductive cancers, organs, type of cancers in females, what it encompasses, and what it is. So, right now, if you could please share this with your friends, with your family. Like I mentioned, we're having a giveaway at the end of today's show. It's very simple. All you need to do is ask questions. It's so simple, right? So, hi everyone. Once again, we have 15 people, and now I'm going to officially begin. Welcome to Talking Live with Macy. It's good to see all of you back. And for those of you who are first timers on this show, this is a bi weekly talk show every Sunday at 3:30 p.m. But we may be reducing it to once a month because things are opened up. And I know a lot of you actually rush back to tune into this show sometimes. So it's either I change the timing but I like Sunday at 3:30 p.m. So I do hope that you guys can continue to tune in to find out more. And I'm very passionate about the topics that we talk about. So today's topic is about reproductive cancers in females. And I think I want to quickly summarize what we are talking about today. Before that, I would also like to thank Prince Court Medical Center for actually bringing our doctor on today's show, and more importantly, for having the promotion that's ongoing till 31st December 2022. And the second part is having a giveaway for people who tune in today. So there are five types of gynecological cancers, which are cervical, ovarian, endometrium, vaginal, and vulva, with endometrium cancer being the most common worldwide. Ovarian cancer is the fourth most common cancer in women in Malaysia, and there are currently no known risk factors for majority of the patients. So I think a lot of people probably want to know, how do we know when we possibly might have symptoms and how to treat it? So Prince Scott Medical Center is giving away two cancer screening packages for females, which includes a pap smear, very important, ultrasound, cancer marker, and a consultation and procedure with a specialist, worth 638 ringgit. And this promotion is valid till 31st December 2022. And for today's show only, we're giving away two lucky females the cancer screening package for females. And all you need to do, how to win it, right, is ask questions. And Prince Scott Medical Center is so gracious to bring on a specialist for us on today's show. We have Dr. Vignes Warren Ramakrishnan, a consultant gynecologist and obstetrics at Prince Scott Medical Center, with over 22 years of experience under his belt. In government hospitals. And he has recently joined Prince Scott Medical Center, and he is so kind to spend his Sunday afternoon with us. So, hi, Dr. Vignesh. I'll unmute you now so we can jump straight into the questions. Thank you for coming on board and for Prince Scott Medical Center for bringing you here today.
Hello, hi, thank you. Thank you for inviting me today, this afternoon.
So, Dr. Vignesh, I'll quickly jump into the questions because there are so many
Yeah,
questions I have.
sure,
And for those
sure.
of you who are tuning in, I'm sure all of you know, start asking questions. That's actually how you're going to win the cancer screening package for females. Okay, the first question on my part is, Dr. Vignesh, could you summarize the areas that cancers of the reproductive organs for females cover?
Okay, now in the female reproductive organ in America and in Europe, it's different. In America, they involve the breast. In Malaysia and Europe and in England, we follow the English style. We concentrate on the pelvic organs. The pelvic organs are the uterus, the cervix, the vagina, and the fallopian tubes and the ovary. Here, I have an image or anatomy of a female pelvic organ. If you can see what I'm holding now, it's a uterus. This whole thing is a uterus. This part down here is the cervix. This is the vagina. All right. And then this is the tube, fallopian tubes. You have two tubes. You have two ovaries. One uterus, at the end of the uterus is the cervix, and then that's the vagina. So those are the female reproductive organs which you should be aware of, right?
So thanks a lot for the model. I like that. We all know better now. So I guess the next question is, what's the difference between the cervix and the endometrium? I
Okay.
think a lot of
Now,
females get confused.
yeah, a lot of people get confused when they do their pap smear. They think they're doing a pap smear. One single test is for screening of all the female reproductive organs. It's actually not true. Pap smear is used widely to screen the cervix. It's the most recognized screening test for the female cervix only. Now, if you understand from this diagram again, hold on. So from this diagram, if you can see, let me see. Okay, this is the uterus. At the lower part of the uterus, you see a cervix. This is the cervix. So from your vagina, you come in here, you do a pap smear, you swab up here. This is called the cervix. The cervix is actually the lower part of the uterus. The uterus there, cervix is here. Now, the uterus has three layers. The three layers of the uterus. This is called the serosa, this is called the myometrium, this is called the endometrium. Endometrium is the inner layer of your uterus where your fetus grows when you are pregnant and when you have a baby. So this is called the endometrial layer, and this is where endometrial cancer originate from.
I
I hope
see.
you all understand from the picture.
Yes, I think that is very clear for us. Now, I didn't know that the
Okay.
endometrium had three layers. Well, now I know.
Okay.
I think the next question is I think cervical cancer amongst the three cancers that we're talking about today is the most kind of like known. So, what are the
Yes.
symptoms of cervical cancer?
Regarding the occurrence of cervical cancer, actually, cervical cancer is still the most occurring cancer in women in the world and also in Malaysia. But if you look into the general population going towards urban population, endometrial cancer is becoming the most increased number as we see as day goes by. In fact, in the UK alone, the most endometrial cancer is the number one reproductive cancer in the country. So when we talk about cervical cancer, most commonly cervical cancer occur in women aged between 20 to 40 years of age or group. In Malaysia, they occur also in the similar age patterns, but sometimes you get in an earlier age. Now, the common symptoms they attribute or the common symptoms they have is postcoital bleeding. Postcoital bleeding means after having intercourse for the first time or after having intercourse for quite some time, suddenly you realize there's some baby drop of blood coming out from your vagina. If you have that occurrence, then you got to go and see a doctor, because sometimes it can be a benign condition, which is not worrying, but sometimes it can be the first sign of you getting cervical cancer because of a lesion
Mm,
in the cervix. Okay. Now,
I
other
see.
symptoms normally present late, and as those are when you have severe pain in the lower abdomen, when you have difficulty in passing urine, when you have lost appetite, loss of weight, when you have severe backache because of radiating pain, because of a mass compressing on your cervix and also the nerves around it. But those people who have those symptoms normally are already in stage 3 or stage 4. So it's very important, if you have any PV bleeding after, or PV bleeding or blood coming out or spotting after intercourse, please get yourself checked, because those are normally the first signs of you getting a cervical inflammation or cancer.
I see. That's
Okay.
interesting to note for a lot of females out there. And I think the
Yes.
more important part for a lot of females is that it shouldn't be a taboo to get yourself checked. A lot
Yes,
of
you should not.
females, yeah. I think I need to address this because I know a lot of females think that if you have cervical cancer, it's a taboo because of the stigma attached to it, but it shouldn't be be the case for that.
Yes, true, true.
Um,
You
yeah.
must always remember that getting yourself screened earlier is much easier for us to treat, because if you present at a later stage with recent advances in medicine, we can still treat you. But the thing is, you have to go through a lot. There's a lot of things you have to go
Yes.
through other than surgery. You have to go through chemotherapy. We can go to
Yeah.
radiotherapy. Now, all this can be prevented if you have done your screening earlier and if you have taken faster action towards the symptoms which had occurred to you.
That's true. So
Okay.
here I am for early detection. And the
Yes.
next question, Dr. Vignesh, is what are the symptoms of endometrium cancer?
Okay. Now, endometrial cancer and ovarian cancer. Sometimes it's very hard to predict because you can have. It's very difficult for you to get symptoms early unless you're menopause. In young women who are still having a menstrual cycle, sometimes most of them, 70% of them present to us with endometrial cancer or ovarian cancer. They present in stage 2 or stage 3. But some symptoms you should be very wary of in endometrial cancer. So in endometrial cancer, I'm talking, I divide it into two. One pre-menopause, that means you're still having your menses, and one post-menopause, when you don't have your menses. If you're still having your menses, if you have heavy bleeding during each cycle, or you have bleeding which occurs irregularly, or intermenstrual bleeding, most of the time they are not worrying, but you should at least get yourself checked once by your gynecologist. Okay, if you have severe abdomen pain, heavy bleeding, you have lost appetite, loss of weight, or you're not sure what's happening, please see your doctor. Because sometimes, although the symptoms are vague or rare, they can show us some signs that you can be in trouble. Now, when I say this rare, because 20 people, 20 women who are in the premenopausal age who have these symptoms, 19 of them will not be cancer. 19 of them can be something else, can be a fibroid, can be endometriosis, can be hormonal levels, can be stress. So do not be worried. But if you have the symptoms, please get yourselves checked. Now, if you go to postmenopausal women, the story changes. Postmenopausal women shouldn't have any bleeding. If you have bleeding postmenopause, you must get an endometrial sample. In fact, there's a rule if you're above the age of 35, if you have severe heavy bleeding or intermenstrual bleeding, you should get a sample of your uterus. Coming to postmenopausal women above the age of 45 or 50, if you have bleeding, get yourself checked, but do not get worried. I'll tell you this phrase. For every 10 women who has postmenopausal bleeding, 9 will be normal. It can be because of inflammation or benign polyp, or because of cervicitis, or because of infection. One only will be cancer. But if you ask 10 people with endometrial cancer, what was the first symptom? They will say, 9 of them will say, I have postmenopausal bleeding. There's a big difference. All right? Do you
I
understand?
see. Yes.
Okay.
So Dr. Vignesh, I think more so is that there's in Asian culture, in Asia particularly, there's this thing where a lot of our parents tell us, oh, if you have heavy bleeding during your period means you're very fertile. I think I've mentioned this before, and
Yes.
a lot of people actually agree with me, and that's the thing that a lot of females don't think that it's necessary to get checked because they think, oh, it's very normal to have heavy bleeding. In fact, I'm so fertile.
No, actually, heavy bleeding is it's a misnomer to feel that you are normal. I mean, heavy bleeding, it is not dangerous. Heavy bleeding does not mean you have cancer. But if you have heavy bleeding for quite some time, you should at least get yourself checked once to know why you're having heavy bleeding. Like I said, those with heavy bleeding, premenopausal, 19 of them will not be an issue. One might have cancer. Postmenopausal, heavy bleeding, most of the time, it can be dangerous. You got to get it checked immediately.
Okay. And I guess the next question I would have is, what are the symptoms for ovarian cancer patients?
Okay. Now, we've been talking about bleeding. Ovarian cancer patients normally do not come in bleeding. Certain types of ovarian cancer can cause you to have a thickened uterus, can come bleeding, but they are rare. Most of patients with ovarian cancer, just like endometrial cancer, they come to us late. 70% of them come to us at stage 3 or stage 4. Reason being because the symptoms are very vague. Most of the common symptoms of ovarian cancer is they suddenly feel a mass per abdomen, number one. Number two, you can have pain in the abdomen because the mass has gone bigger and there's no space for it to grow, or the mass inside the abdomen, the ovary inside the abdomen has twisted, it has turned and twisted, causing torsion, which is the one causing the pain to you. Or the ovarian tumor has ruptured, it's causing bleeding, and therefore you get pain. So the other symptoms you have, but also normally when you're already in stage 3 or stage 4, is when you lose weight, you lose appetite, you don't feel like eating, you have back pain, you don't you feel like you cannot lie down properly. So if you ask me, ovarian cancer, can you detect early at stage 1 and stage 2? The answer is no, because symptoms can be very not some patients can have no symptoms at all. Some The most common symptom you should know is that you will have pain in the abdomen. If you have any pain in the abdomen and you're eating your periods are irregular, you get yourself checked. If it's normal, then there's no issue. Now, when we come, because like I said, if you want to screen for cervical cancer or ovarian cancer or endometrial cancer, the most recognized is pap smear. Pap smear is the only screening cancer recognized for cervical cancer in the world. And we have actually moved forward from pap smear to HPV testing, which I'll come to
Yeah.
later. We just don't do pap smear now, we do pap smear and HPV testing. There is no recognized screening program for ovarian cancer or endometrial cancer in the world. Just for the fact that if I see you today, everything seems normal, something can happen again in 4 months' time or 6 months down the line. But it's advisable for you to get yourself checked once a year, or if not twice a year, or maybe once a year, I think it's fine.
Yeah.
Because sometimes you already have the thing, but you do not know unless you get yourself checked. When you get yourself checked and you come and see a doctor, he'll ask you, do you have any symptoms, which is worrying? Do you have any signs which a doctor can elicit from examining you? Then he will do a scan, and then also there are some basic tumor markers we can send and see if everything is all right. If everything's all right, then it's highly likelihood that you do not have any issue, and we can see you back in a year's time. Also, there are some family members who have higher risk of getting a cancer because of genetic mutations, BRCA1, BRCA2, or Lynch syndrome, which is linked to bowel cancers or breast cancers. Now, those factors, those women, they need to come earlier. They need to discuss with the doctor and see what's the best option for them. And normally, a gynae oncologist can give them a good advice in telling them, okay, you have this, you have this, you have that. This is option A, option B, option C, option D. What I think we should do for you. Let's talk.
Okay. Thanks a lot
Okay.
for the details, Dr. Vignesh.
Okay.
I
Okay.
I think you were talking about how the symptoms for all each of these cancers. So, what
Correct.
are early detection methods, if any, for each of these cancers?
Okay, I'll talk one by one, and we will start with cervix. So cervix, it's recommended before to do Pap smear every 3 years. Okay, you start doing a Pap smear from the age of 18 to the age of 65, and then from the age of 65, it's up to. Previously, they said it's enough because from a cervix undergoes changes involving the walls of the cervix, and before they become malignant, they undergo a condition called pre-malignant lesions, CIN1, CIN2, CIN3. Before a normal cervix cells can change to become a cancerous cell, it will take between 6 to 10 years. So previously, people live up to the age of 70, so they say stop doing a pap smear at 65. But now you can do up to the age of 75, 80. It's up to you. Um, we, however, have introduced in Malaysia, which started 2 years ago in the government sector as a universal program free by the government. This initially it was initiated in Alostar and in and Kelantan and Terengganu, and this year it was in brought to Putrajaya, Selangor, and a few other states. I'm not sure. Eventually, it's going to go worldwide. We're introducing HPV testing with Pap smear. Why is HPV
Mm,
testing and Pap smear important? Because we know 90% of cervical cancer is caused by HPV. So if your HPV is negative, then the risk of you getting cancer is very low.
low. Mm,
So if you do a HPV test, if your HPV is negative, you don't have to do a pap smear every year or every 3 years. You can do once every 5 years. If your HPV is positive, then depending on what kind of HPV is positive, we will decide whether we want to do a colposcopy. Colposcopy means it's a procedure where you use a microscope to look into your cervix and take a biopsy if the need arises, or whether we can wait and repeat a pap smear in 6 months' time, right? This is about cervix. So cervix, we do pap smear, and it's essential for you to do it at least every year or every 3 years. But if you can do HPV testing together with pap smear, then you can do it once every 5 years, provided it's normal. Now, going to ovary and endometrium, like I said, there is no recognized screening program for CA ovary or CA endometrium, but we use certain basic tools to assess in case you have higher risk factors. So when you come and see a doctor, they will see, do you have risk factors of getting CA ovary, like anybody in your family members, two siblings or two family members in the past 2 generations who had any breast cancer or ovarian cancer, then you might have a higher risk. Then maybe we can do some blood tests to look for you to assess whether you have BRCA1 or BRCA2. If anybody in the family has got bowel CA, then we want to see whether there's a link between bowel CA and whether it's going to affect you in the future. So when you see, so we have designed and created a program so that we can catch you. But you must understand it is not a screening program which is universally done worldwide, because there is no such program. Like I said, this ovarian endometrial cancer, they can come up suddenly out of nowhere. But we got to know that you are completely free before, and so that we will know how to treat you in future. So if you come to us for endometrial cancer screening, we will ask you for your history and signs and symptoms. Then we'll look at the scan. We will look at endometrial lining. Your endometrial lining should be below 5 millimeter or 3 millimeter. Normally, postmenopausal women should be below 5 millimeter, premenopausal above 5 millimeters. And they also have specificity. That means if you use below 5 millimeter, risk of you getting endometrial cancer is probably 1% or less. If it's below 3 millimeter, then it's probably 0.5% or less. Same thing goes for postmenopausal women. And for ovarian cancers, there are certain markers we can send. When you're at a younger age, we send different markers. When you're older age, we send different markers. And also, like I said before, endometrial cancer, ovarian cancer, early stage can be missed. If you come to us, see to us, we can examine you, we can do a scan, we can see everything's all right. Then for the next 1 year, most of the time we should be all right. Then we can do a screening program every year just to make sure everything's all right.
I see. Thanks a lot, Dr. Vignesh. I think my
Okay.
last question for you before we take on questions from the audience. Well, once again, to all of you watching, Prince Court Medical Center is gracious enough to be giving away two cancer screening packages for females worth 638 ringgit for today's show. All you need to do is ask questions, and we'll announce the winner in a day or two on this page, and also on in this comment thread. So put in your questions now. We're going to pick the winners at random. All you need to do is ask questions, and I think it's very important to be aware. So my last question for you, Dr. Vignesh, is what are the treatment options for each cancer, and does it differ?
Okay, when you want to treat woman with cancer, the treatment depends on whether you are postmenopausal or premenopausal. Depends on whether you want to have children in future, or whether you have completed your family, and then we decide how to go from there. So, for example, since we're doing reproductive pelvic organs, I will say most of the time for surgery, cervical cancer, the treatment is surgery. Okay, you have surgery, you have radiotherapy based on the staging. Stage of cancer is stage 1, 2, 3, and 4. If you are stage 2B and above, there's no role for surgery in cervical cancer. You have to go for radiotherapy. When it's stage 2B or below, 2A, 1B, 1A, in America, 1B2 and less, they do surgery. 1B2 and above, they advocate radiotherapy. But here, the Japanese and Koreans, they do more surgeries, and actually they have better outcomes. So we still practice surgery, because surgery has a better chance of getting a clear margin which is free from cancer. So in cervical cancer, normally we will do surgery with 2A and below, and then we will check at the HPE, which is histopathology of the specimen, whether you require further treatment with radiotherapy or chemotherapy. In ovarian or endometrial cancer, the treatment is surgery, remove the mass, remove the cancerous tissue, and then decide whether you require chemotherapy or uh, radiotherapy. In ovarian cancer, most of the time we do not require radiotherapy. Ovarian cancer, if you are stage 1A, that means it's only limited to one ovary, surgery is enough. Endometrial cancer, same, 1A, less than half the myometrial tissue is involved, surgery is enough. Only if it spreads beyond stage 1A, then you probably require radiotherapy or chemotherapy. Now, I'll concentrate on those who are young women who are in childbearing age. If you have cervical cancer and it's only stage 1A, which is very small, we can just take part of the cervix and leave the cervix behind. That means future you can still conceive. If it's involved this whole cervix, then we can take out the cervix, not the whole cervix. It's bigger than 1 centimeter. Involve the cervix one A. Then we can decide, instead of doing wartime hysterectomy, which is a radical hysterectomy, we can do trachelectomy, where we take out the cervix and lower part of the uterus. But we still give you the option of getting pregnant. Now, the risk of you getting pregnant after the surgery it's still there, but it's quite difficult. But you must understand, you still can get pregnant. Now, if you have endometrial cancer applies to the lining of the uterus where the baby is supposed to be there in the first place. So in endometrial cancer, what we will do is we will try to preserve the uterus. And to preserve the uterus, we will give you high dose progesterone. High dose progesterone can be given orally, and we can also supplement by giving something intrauterine into your uterus, which is called Mirena. We will give this, and we will try to see whether this high dose progesterone can uh, convert back your tissue into normal tissue. This can, you must understand, endometrial lining, it goes through few layers, a few phases before they become cancer. So in my practice, we have treated about 100 or 200 women with endometrial cancer with high dose progesterone, and about 10 of them or 20 of them have reverted back to normal. But sometimes those pre-malignant lesions, hyperplasia, also, we give progesterone, and but for every 10 women I treat, five will come back to normal. Some women we cannot. We although the best of treatment we do same as the best as we do as in Cleveland in US, or Harvard in US, or Oxford or Cambridge in England, or we follow Samarkand in Germany, or Strasbourg University in Germany, or those in Japan. We follow the same things. Sometimes we cannot fight cancer because it has different categories or different types of mutations. You must understand cancer is not only one type. There's cancer types, about five, six of them. There's cancer variations, five, six of them. I'm speaking in terms so that you easily understand, but normally we have grading and staging types of cancer, and we have to see what's the best option for you when we want to treat them. Now, when it comes to ovarian cancer is very simple. If you have completed your family, we go in, we take out the tumor, which is the ovary, and we remove the whole pelvic organs. And also we remove the omentum, which is part of the fat covering the bowels, and also the appendix. We will see if it is involved. If it's involved, we will remove it. And then we will check the lymph nodes to see if the lymph nodes are involved or not involved. If it's involved, we will remove it. And then based on that, we will see how best treat you. But if you have not completed your family, if you are still keen to get pregnant, or if you're getting ovarian cancer young age of 15, 17, 18, 20, what we normally do is we will remove that ovary. We will check the other ovary. Our other ovary is normal. We will check the omentum. We will remove the omentum. You must understand why we're removing the omentum and the ovaries, because when you were young, before you were born, this omentum, ovary, and the appendix, they all come from the paramesomnephric duct from the same root. So that's why we will check to see if they're involved, and we remove it. Now, after removing them, we will see what is your stage of cancer. If your stage is 1A, it's only limited to the ovary, then we don't have to do anything. But if the lymph nodes or the omentum is involved, then we'll give you an option. We will always give you an option, and then we'll advise you what's best for you. So normally we will advise you because you're young, you have not completed your family, or you're not married. So we will say, you know what, we will give you chemotherapy, and then we will see how it go from there. We'll monitor you. But before giving chemotherapy, we'll give you options of storing your eggs, because chemotherapy sometimes can affect your ovaries and your eggs. So we will tell you, you can either preserve part of your ovary, or we can stimulate your ovaries to release eggs, and we get the eggs and keep them in a IVF center. Or we can also, if you're already married, we can get the eggs, get embryo done, make an embryo, and then keep the embryo, which is much better. Or we can suppress your ovaries first with some medicines before we start giving you chemotherapy. It's a bit confusing. Do not get confused. Normally, if you have cancer, our aim is to do surgery. But if you are young, what we're trying to do is we will try to conserve it by giving hormonal medications if applicable.
All right. Thanks for it. That was very, very insightful, Dr. Vignes. I
Thank you.
really, really appreciated that.
Yes.
I think everyone who's tuning in does too. So thank you so much. Currently, Prince Court Medical Center is having a promotion to offer pap smear ultrasound cancer marker and a consultation procedure by a specialist worth 638 ringgit. And this promo is valid till 31st December 2022. You guys can just call Prince Court up to find out more. And of course, we're giving away two of these packages today. All you need to do is ask questions. So now we're going to take questions from the audience. I think I'll take from the first person who asked, Dr. Vignesh. Uh, Avril asks, for female age 35, how often shall you suggest for females to check up like pap smears? And are there any specific checkup other than pap smear that is recommended?
Okay. If you're 35 years old and you want to do a pap smear, you do a pap smear once. Normally, the rule is you do a pap smear one this year, then you do one if it's normal, you do one the following year. If it's normal, then you do every 3 years. right? But now we advocate you do HPV testing with Pap smear. If you do a Pap smear and your HPV testing is normal, then you just have to do it once every 5 years. You don't have to worry about anything. You must understand, Pap smear it's only for cervical cancer. It does not rule out ovarian endometrial cancer. So if you want to do ovarian endometrial cancer, you can go and see a doctor and see whether you have any risk of getting ovarian endometrial cancer. Sometimes it's very difficult for us to predict you have risk or not unless there are family members who have it. But then we can always see, we can always maybe do a scan and get some markers and see, okay, everything's all right. Maybe if you're worried, we can follow you up every year or so. Okay,
Okay, thanks a lot, Dr. Vignesh, and also thanks for your
sure.
question, April. So Miss Swana asks, HPV has been strongly linked to cervical cancer. What are the risk factors for HPV infection, and how do we check if we were infected? The next question I feel is something that again is a taboo linked to cervical cancer. She asked whether it is sexually transmitted.
Okay. Now, HPV, it is normally because of sexual transmission. You get HPV infection because of sexual transmission. But it does not mean if you're a virgin that you cannot get HPV infection. In fact, there was a large study done 2 years ago involving women between the age of 18 and 25, and 46% of them denied having sexual intercourse, but 46% of them had HPV infection. So then they had understanding that sometimes you do non-intercourse sexual acts which can lead you to get HPV infection. For example, you practice oral sex or because of certain other things which you do. That is why now we advocate for you to get HPV vaccine, not only for men, not only for ladies, but also for men, because men have, just like cervical cancer in ladies, men nowadays tend to get nasopharyngeal cancer because of HPV, because of oral sex. So that is why HPV is caused by sexual transmission. You must not. There is no do-how about it. It is because sexual transmission. But if you are a virgin, you can still get HPV infection because they can transmit to other means rather than by intercourse. And how do we check if you are infected? It's very simple nowadays. There are a lot of programs where you can buy it. You can even buy it in Shopee or Lazada. If you don't want to see a doctor, if you feel shy, you don't want anyone to know
Mm,
what's happening, you can just go to Shopee or Lazada, just order this HPV kit where you can just test it yourself and send it to the lab, and the lab will tell
yeah,
you, okay, you know what, I have HPV, and if it's negative, no issue. If it's positive, then maybe you should see a gynae oncologist.
all right. Thanks for your answer, Dr. Vignesh. And the
Sure.
next question is from Tracy. She asked whether HPV can cause ovarian cancer.
HPV normally does not cause ovarian cancer. HPV stands for human papilloma virus. They're normally in the cervical area, but having HPV positive does not increase you from getting ovarian cancer compared to women who have HPV negative.
All right. And Miss Swana had a follow-up question. For those who have already menopause with strong familial link to gynecological cancers, is there a role of preventative surgery of removal of uterus, ovaries, and cervix, basically hysterectomy, and is it practiced in Malaysia?
Okay, this thing is actually became interesting since 15 or 10 years ago. I'm not sure. Like I said before, if you have BRCA1 or BRCA2, I mean, if for every 10 ovarian cancer in Malaysia, you must understand, if you have ovarian cancer in Malaysia, there are certain tests we can do, but nobody tests for BRCA1 or BRCA2. I mean, for every 10 surgeries done, only one get tested. But there is a normal understanding all around the world for every 10 ovarian cancer, one will be because of BRCA1 and BRCA2 link. It's a gene mutation. So if you have that gene, the risk of you getting ovarian cancer or breast cancer is about 60% at the age of 60 years old. So now what happened was 10 years, we already knew this 50 years ago, but what happened was 10 years ago, Angelina Jolie had the ovaries removed and the breast removed. It's because she had this BRCA gene. Okay, so if you have two family members in your family, that means your mother, your mother's mother, and your mother's mother, your grandmother. If two family members in those three generations have had any form of ovarian cancer or breast cancer or bowel cancer, you can get yourself checked for BRCA gene. If your BRCA gene is positive, then yes, there is an option of getting a surgery done to remove your uterus and your ovaries.
Okay, thanks a lot, Dr. Vignesh.
Okay.
Ms. Darshini asks, does a normal CA125 level means that one has low risk or no risk of ovarian cancer?
Okay. Now, CA 125 levels is a guide. It's a guide to tell us
Yeah.
whether you have cancer or not. Sometimes a normal CA 125 does not mean you have no cancer, and a raised CA 125 does not mean you have cancer. So it was actually a guide. CA 125 can be raised in certain benign conditions, inflammations, certain fibroids, most of the time endometriosis, which are not cancer. They can be raised, so you do not have to get worried because there are a lot of blood tests out there doing CA 125, CA 19.9. They are raised and they come to me. They say, "Oh, it's cancer. I have to do something." And then I look at you, I look at the profile, examine you, and I'll tell you, you know what? You don't have to do any surgery. But then they say they've gone and see other doctors. They say have to do surgery. I say no, you don't have to do any surgery because it's probably endometriosis. You don't have to do anything. But in certain conditions, you get a raised CA 125, and then which you do a normal screening, like this year I had three or four. They come to me, and then I see a big, huge ovarian cyst. And huge ovarian cysts, you can when you see an ovarian cyst, there are certain features we have to see whether they're dangerous or not. Anything more than 5 or 6 centimeter, we will say remove it. Anything less than 5 centimeter, we don't want to remove it unless your CA 125 is raised. But if your CA 125 is raised and the cyst about 4 or 5 centimeter, it can still be endometriosis, or cyst can even be bigger. Then there are other features you have to look, whether it's multiloculated, whether there's any papillary projections, whether there's any free fluid. So features a doctor knows when they see in scan, then they will advise you accordingly. Maybe you know what, I think maybe surgery will do you some good, and maybe we want to do surgery for this case. But the thing is, you got to understand, raised CA 125 does not mean you have cancer. Normal CA
Mhm.
125 does not mean you have no cancer. But it's a guideline to help us to understand what you're going through, what you have, and help us to guide, you know what, should we do something or don't do anything? Okay.
All right. Thanks, Dr. Vignesh. I'll
Okay.
take three or four more questions from the audience. I'll pick and choose. I think Miss Darshini had a follow-up question. I think this is an interesting one. What test would you recommend for someone with strong family history of colorectal cancer who is keen to know her chances of having ovarian or endometrial cancer?
Now, if you had history of colorectal cancer, there is a link called Lynch syndrome. We actually can get it tested because there's a risk of you getting ovarian cancer. But Lynch syndrome causing ovarian cancer is actually very rare in Malaysia. It's normally in Caucasians or in Japanese or Koreans. In fact, in the past 300 or 3,000 or 4,000 gynae oncology surgeries I've done, I only had one Lynch syndrome. That was not tested, but we perceived it to be Lynch because she had three family members who had bowel CA. So normally, if like I said before, anybody in the family had two of them in the three generations had risk of getting cancer, you come and get tested. If only one of them get, then we come and see whether you have risk factors of getting cancer. Do a screening. We will look at the uterus. We look at your signs, symptoms. We'll do some basic blood tests and see. You know what? I don't think you got to be worried. We can always see you every year and follow up and see how it goes.
All right, thanks. Next question is from Miss Audrey. For menopausal women taking hormonal pills, can it cause uterine cancer?
Okay, you must understand. Menopausal women, you take the hormones because sometimes some women cannot tolerate not having any estrogen. So the dose of hormones we give you, it's actually very low dose. It normally does not affect the uterus. It normally is just enough to get for you to get a bit of the estrogen you were getting before. Um, Women can also get estrogen from their fat cells because of enzymes called aromatase. We can convert the fat cells into estrogen in your body. So taking HRT normally does not increase your risk of getting endometrial cancer. Taking HRT, now a lot of people argue me, but there is a huge papers, a lot of controversy about it. Can cause you risk of getting breast cancer, although it's very, very, very low. So if you need HRT, please take your HRT. If there is no risk of you getting endometrial cancer. But if you're on HRT and you had any postmenopausal bleeding, come quickly and see the doctor. Do not think it because something else. Okay, nine out of 10 times normally is nothing, but then you should get yourself seen by a doctor.
Okay. Thanks a lot, Dr. Vignesh, and also to Audrey. I think that I'll take the next question from Ms. Rema. Is it necessary to have the surgery performed by a gynec oncologist or any available gynecologist in the event that it is ovarian cancer?
If you have gynecological cancer, your surgery is ideally best done by a gynae oncology surgeon. In fact, in the UK and in the US, all cancer surgeries are done by gynae oncology surgeons because
Yeah.
nowadays many people do not understand what margins, what planes you have to do. They think hysterectomy is simple hysterectomy, but hysterectomy there are five types. There are margins you have to go through, the nerves you have to preserve, the nodes, lymph nodes which we have to remove, and only gynae oncological surgeons are trained to remove lymph nodes. And then you got to do your bowel. So in my previous practice in government, we do everything. Sometimes we do our own bowel, our own bladder, our own ureter. We do our own connection because we got posted Sabah, Sarawak, in rural areas in
Mm.
Semenanjung and all that. But here in private practice, yeah, I don't do all that. Even if bowels involved, we call the surgeon. Bladders involved, we call the urologist. But if you are doing a gynae oncological cancer case, because he has to get a nice margin, he has to get the lymph nodes, he has to get the plane, and he'll know what to look out for. Okay, because we have to look at your
Okay.
liver, we have to look at the diaphragm, we have to look at the undersurface of the bowel, we have to do a proper omentectomy, and normally gynae oncological trainees and doctors are trained to do that. In fact, before I came to Princeton, we had trainees, and I have trained few of them to do a gynae oncological surgery before I left the government service.
Interesting to know that.
Okay.
I guess I'll take the next question from Ms. Pavintran. She asked, is there any association between HRT and ovarian cancer?
HRT and ovarian cancer. Actually, answer is no. In fact, people who take oral contraceptive pills have a lower risk of getting ovarian cancer. There's a paper for it. So if you've been taking oral contraceptive pills when you are not menopause, risk of you getting ovarian cancer is less because probably it controls the amount of estrogen in your body. So based on that paper, if you take HRT, the risk of you getting ovarian cancer it is not unlikely to be high. Like I said before for the other question, the hormone in the HRT is just low enough just to maintain the integrity of the woman, to keep the skin moist, to keep your bones strong, to keep your heart and kidney strong, and to keep your well-being as if you have not achieved menopause. But the dose is not strong enough to cause any harm. But
I see.
saying that, if you're on HRT, you have any symptoms, then you have to obviously see a doctor because you might be getting cancer because of some other reason, and you might be taking HRT, and they may be two different pathways. They may not be related. So you got to get yourself checked if you have any symptoms. That's all.
I'll ask one or two last questions. Thank you, Dr.
Sure,
Vignesh.
sure.
The, uh, the next question is, do fertility drugs increase the risk of ovarian cancer? And what is endometriosis? Can it cause ovarian cancer?
Okay. Question number one. If you stimulate your ovaries with hormones, they will cause your eggs to grow. So if you stimulate anything to grow, then there is a small risk of causing it to grow beyond what it's supposed to grow. So you must understand why you get cancer in the first place. Cancer means the cell is trying to die, but it cannot die. So it mutates, outgrows, and it transforms a different way. So I have received a few patients over the past years who have undergone multiple stimulation and we got an ovarian cyst and they've ignored it because they didn't go for follow-up or so on, and that has become cancer. So the question is, if you stimulate your ovaries to get eggs, is there a risk of you getting cancer? Answer is yes, but it's very, very, very rare. If you follow the treatment, follow up, and your fertility specialist sees you, he knows what to do, then it's no issue. You will not get cancer. Now, the second question was, what's second question again? Sorry.
What is endometriosis and does it cause
Okay.
ovarian cancer?
Okay. Endometriosis and ovarian cancer. Now you must understand what is endometriosis in the first place. I will come back to the diagram. Okay. Like I mentioned, the uterus has three layers. The uterus has three layers. This is the serosa. Here is the myometrium. Here is your endometrium. Now, if endometriosis. Endometriosis means inflammation of the endometrium, which has migrated. So every 100 women in this country or in this world, 10 to 15% can get endometriosis. Why you get endometriosis, we are not very sure. But but most understanding physiology is that when you get period, not only a period goes down here and comes down outside, It also goes backwards into your tube, into your fallopian tube, and comes out. So sometimes this endometrial wall tissue from here, endometrium, it inflamed, it gets migrated. That's how you get endometriosis. So if you can see clearly here, you can see these black dots. These black dots, they can get implanted in your uterus myometrium. You get something called adenomyosis. You can get planted here. Sometimes you can get planted in your ovaries. You can get planted in your tubes. And when you have endometriosis, you get severe pain. In rare cases, you can get headache every time you get period. You can get chest pain every time you get period. You can get stomach pain every time you get period, because those endometrial tissue has gone there. And every time you get period, those areas get inflamed, they bleed, but there's no way of it shrinking and disappearing. So to control endometriosis, there's certain other things we have to do, medications and surgery. But if you have endometriosis, most of the time when you have endometriosis, you can have endometrioma, because the endometrium, the closest part of the fallopian tube where the bleed comes backwards, 10% I say go backwards, it goes to the ovary. So when it goes to the ovary gets bigger over a period of time. So when the ovary gets bigger over a period of time, you get something called endometrioma. So that can be very painful. Then we remove the ovary. But when we remove the ovary, some people, they said they've done surgery for endometriosis, endometrioma, and after 5 or 6 months or 1 year, you get a cyst again. That's because the pathology has not been pathology has been removed, but the underlying physiology is still the same. You still get a bleeding which goes backward. So that one we have to control with medication. Now, if you have endometrioma, which is ovarian cyst caused by endometriosis, 1% of them can convert become cancer, which is clear cell carcinoma. So if you have endometriosis, endometrioma, no, more than 5 centimeter, normally we will say we do surgery, take it out, we look at histopathology. If it's all right, then we follow you up normally. But if it's not all right, then we will advise you how best to deal with it. It depends whether you have completed your family or you have not completed your family.
All right. Thank you so much for answering that question and for the details involved in that. Thank you so much, Dr. Vignesh, for joining us on
Thank you
today,
for
a
inviting
Sunday
me to the
afternoon, for coming to the hospital and answering all of our questions.
Yes,
Thank you
yes.
so much. So, Dr. Vignesh is a consultant gynecologist and obstetrics at Prince Court Medical Center, and we'll announce the winners for the giveaway either tomorrow or the day after. And guys, remember that Prince Court Medical Center is currently offering a cancer screening package for females, which includes a pap smear, ultrasound, cancer marker, and consultation procedure by a specialist worth 638 ringgit, and this promo is valid till December 31st, 2022. So remember, ask for it if you want to, and I highly suggest that you should, because early detection saves lives. And Dr. Vignesh has also mentioned that a pap smear is important as well as HPV testing. So that is also included in the package. So once again, thank you, Dr. Vignesh. Thank you
Thank
all of
you. Thank
you
you for having
for all
me.
of your questions, for joining us. And more importantly, thank you, Prince Scott Medical Center, for joining us, for having today's show for us with Dr. Vignesh and the cancer screening package. Thank you, ladies. And remember that understanding our reproductive organs and the functioning of it is very important. I cannot stress that enough. Thank you so much. And next month, we will have another session. Stay tuned for it on my social media. And I hope to see all of you soon again. Have a good Sunday ahead, everyone. Thank you, everyone. Bye.
Thank you. Bye.